Okay, great. All right. So this is a manual muscle test for the supraspinatus muscle. It is a super muscle. And that lies along the upper portion of the spine of the scapula, thus the name supra, above, spinatus, the spine of the scapula. All right, so this allows us to go into shoulder abduction. So this is what allows us to open our arm up like that. And so the way you do this is you bring the arm out to about 25 to 30 degrees, right? So here's 90, here's 45, 25 to 30 is just a little bit less than that. And your hand's going to be roughly over the outside of the wrist, maybe around triple heater 4, triple heater 5. And the line of drive is going to be towards the hip. Again, it's going to be a little bit off the table, okay? So maybe keep your arm straight if you can, if that's comfortable. And the way you support this movement for the patient is you put your opposite hand on the opposite ASIS, right? And that will stabilize the hip and stabilize the body and help isolate that muscle. Again, no manual muscle test is going to perfectly isolate just one muscle. That's really quite impossible. But this is going to be the predominant muscle that helps us to resist in this movement. Okay, so about 25 to 30 degrees of abduction, and then we're going to be bringing the inside of the wrist to this hip. All right, and resist, and resist, and resist. Okay, and then relax. And then one more time, and resist, and resist, and resist. Okay, so we can see that there's a little bit of supraspinatus weakness, not much, a little bit, but it wasn't quite locking. It did show some resistance, especially at the beginning of the movement, less resistance and less power at the end range. Any pain or discomfort? No. So you always want to check in to see, is there any pain or discomfort? And if so, where? Because they might not just feel it there. Don't just assume that they say, yes, I feel pain, that they're necessarily feeling it in the muscle that you're testing. They may actually feel it somewhere else, which is going to give you an indication of like the muscle train and therefore the channels that might be involved, including the sinew meridians. So that is the manual muscle test for the supraspinatus muscle.